Hi, I'm Lee Kelso, host of the HealthCall Live Radio Hour. I am glad you're here to explore why baby boomers are killing themselves. This has grown to become truly a national health problem. I want to throw some statistics at you just to get started here. And really, the problem seems to be the greatest among white men. As a percentage, they are the leading number of people committing suicide in the country. And it's kind of disturbing that they're pretty darn good at it. As a matter of fact, 1 in 4 suicide attempts are successful in the older population. That's different from teenagers and others who are not as successful. And even though this segment of the population makes up only 12% total, we're seeing 18% of the suicides. And there are a number of reasons why. And we'll be talking about them and trying to understand that better today as we talk with our guests. And first will be Kathleen Cameron. She is the Senior Director of the National Council on Aging's Center for Healthy Aging. And also joining us today is Dr. Marilyn Mendoza, psychologist and author working at Tulane Medical Center. Ladies, thank you so much for joining us. Kathleen, let me get started with you. So the baby boom population is growing. We're all getting older. Is the pace of suicide keeping pace, or is it accelerating?
We are seeing increases in suicide, as you mentioned, among the baby boom population and the generation above as well. Prior to the pandemic, suicide rates were increasing, across many population groups, including older adults, due to, for example, kind of the deaths of despair that we've been talking about over the last several years. And for older adults, we are seeing significant increases in suicide, particularly among older white men, and we can talk about those reasons. Interestingly, though, during the pandemic, we actually saw a slight decrease in suicides, about 2% across the males and 8% across female decrease in suicide. And that might be because during the pandemic, we saw people kind of pulling together in this time of crisis. Many people were at home. Some were actually more connected to their families and their friends during the pandemic. So I just wanted to kind of provide that as the context for the discussion.
Yeah, so we've got some background there. Marilyn, go right ahead.
No, I just wanted to say there was some conflicting information that was coming out about the number of people, and that initially within the first 6 months the rate had decreased, and they were expecting it to increase because after the 1918 flu and the SARS epidemic, the rate of suicide in the elderly did increase. But we don't have all the statistics, but I hope that it didn't continue to increase, so that it stayed lower.
Well, and part of the problem here is we don't really know, right? I mean, there's the challenge of silent suicides.
That's
Marilyn,
right.
What is that going on?
Yeah. Silent suicide is when the individual has pretty much just given up hope. They'll stop eating, they'll stop drinking, they stop interacting, and they just die that way. And it's hard to call that a suicide. That's why it's called a silent suicide, that they believe that the numbers are perhaps larger as a result of those.
Do we know anything more about how many people just go unreported?
Oh, that's a good question. We know, upwards of 20% of older adults experience depression. And those who experience depression are at highest risk for suicide, and particularly those who have had chronic depression throughout their life or other types of mental illness, bipolar disorder, schizophrenia, chronic anxiety, for example. But depression is becoming more common as people age, and that's for a variety of reasons. Often loss of social connections that happen as we get older. Retirement for some people can be very difficult because that's a loss of connections to coworkers, or a loss of, what has really provided meaning and purpose to an older person's life. And maybe also, as we get older, we experience more chronic illness, and that is associated with higher rates of depression too. It could be things like heart disease, stroke, Parkinson's disease, cancer. all have correlations with increased rates of depression, as well as the economic strain, too, as we get older, not having the same level of financial security as we might have had while we were working. So all of those factors kind of play into the increased rates of depression that can lead to suicide ideation in older years.
Yeah,
I think along with that is the fact that there's a lot of grief that's going on. We grieve the loss of our health, of our family, and we can grieve all kinds of things. And I think that, that's a large part of the depression is grief.
Yeah, I get that. You become invisible as you get
Absolutely.
in advanced age.
Mhm.
Marilyn, put some more words with that. Explain what that means.
Well, people don't pay attention to you. They don't listen to you. They dismiss you. My mom lived to be almost 96. And that was one of the things that she complained about is people didn't talk directly to her. They would talk to whoever was pushing her wheelchair. And so that feeling of being dismissed is very painful.
And as we, kind of move to a new stage of the pandemic, making sure that older adults are getting out and getting connected to others in their community is, I think, vitally important.
Are there life events that tend to function as a trigger?
I think loss of a spouse is a significant one, which leads to the depression that Dr. Mendoza was talking about, but also, changes in our life as we age. I think the work in retirement is a significant factor as well. And that may lead to maybe changes in where someone is living. They may have to relocate, or as someone develops more chronic illness, their everyday function declines, they may need to move to assisted living or some other level of care. So that's a major factor too in depression for older adults.
So I have read that, and I mentioned it a moment ago, seniors tend to be very effective at this because they tend to choose more violent means, and it is a planned experience. It's something they've thought about, they're settled with the idea, they have a plan, they're going to get it done. So let's shift a little bit to taking a look at what are some of the warning signs that we need to be aware of?
Increased isolation, decreased intake of food, things that they were interested in before, they have no interest anymore. Things like that, if they start to give away belongings. So some of the typical signs that somebody's in trouble, depressed and suicidal, are what we're looking at. But yeah, the lethality is great. They mean it when they attempt it.
Yeah, they mean it. That's a good way to put it.
Mm-hmm.
And I would just add to that, other things that family members and friends can keep an eye out for, things like not wanting to engage in activities that the older person, traditionally had loved to do, not wanting to do the hobbies, having no interest in those sorts of things, feeling sad, feelings of despair, maybe even personal hygiene changing. That often occurs with depression. Yep. Maybe the home is more cluttered. They're not taking care of their mail. Another thing that we see also is increased use of alcohol, sort of as a way to self-treat the depression, or increased use of prescription drugs. Again, as self-treatment, it could be things like medications that are being used, for short-term sleep problems, or being used longer or at higher doses, or pain medication. Pain is often a sign of depression too, with increased use of pain medications, including opioids, which pose lots of risks for older adults.
Marilyn, I saw you nodding pretty vigorously there.
Oh, yeah. I agree with everything that you're saying, that, there's so many signs, but if people are ignoring you, then they're not going to see that. And I think people are also afraid to bring it up. It's the old myth of if you bring up talking about suicide, it's going to make somebody commit suicide or die by suicide. And that's just not true. So we have to be brave enough to talk with someone that we think might be having a tough time and thinking about suicide. It's not going to make them do it.
Guide me through that. Do I just flat out ask, have you thought about suicide? Are you thinking about doing something? Is that how I move forward on that?
Well, I would start off by just paying attention to what they're doing. Is saying, I've noticed that you're not keeping up with your daily hygiene, or you're not eating very much, and explore things with them in that way. I'm wondering what you've been thinking, and just see how the conversation goes. It may need to be more than one conversation, but I think it's, having that connection and talking about it is very beneficial.
What if they say yes? What then?
Well, I would probably stay close by them. I would ask them also, if they had some specific plan, what they were going to do. I would call their physician, or depending on, how lethal it is, maybe even taking them to an emergency room to have that assessed and see whether or not they need to be hospitalized. Mm-hmm.
Let me jump on the other side and into sort of a controversial area. If I'm 86 years old, I've been living in chronic pain, I might already have a terminal disease, maybe I'm afraid of losing myself to dementia more than I already have. Mm-hmm. Is it wrong? Are we going to make people feel guilty by talking about this if that's the choice they've made?
If somebody has their mind made up, they're going to do it. I was at a workshop once, and the instructor was talking about working with adolescents in prison and suicidality. And he said, he was in the cell with him, talking to him, and the kid took a sock and shoved it down his throat and killed himself right then and there. So, if somebody is determined to do it, I think that they're going to do it. And some people are smart enough, if they have their cognitive abilities, they just might deny that they have those intentions and go ahead and kill themselves anyway. But I think people are so afraid of feeling guilty that they've triggered that they don't want to deal with it.
And I think there are so many people, too, who may not know about what's available to help them, whether it is the depression, that it can be treated, can be successfully treated, or chronic pain, looking at what all the different treatment modalities are that they're not aware of, that their healthcare providers might not have talked to them about. So really having that deeper conversation about what the root cause of their suicide ideation is, and addressing those root causes.
I think more can be done in intervention ahead of time.
Yeah. And I think the earlier the better. So, screening people is very important. Having an annual screen for depression through, for example, the Medicare annual wellness visit is really critically important. A lot of folks on Medicare don't realize that a free benefit, it's a prevention service under Medicare, is the annual wellness visit that covers a lot of different areas, and depression is one of them. So one message I have is for those listening is ask your doctor about the Medicare annual wellness visit to get that done. And that can identify not only depression, but other problems that you might have that maybe have been underlying and haven't been addressed, because there could have been something else that the doctor's been focusing on, for example.
Well, yeah, I was going to get there. There are a fair number of medical professionals, healthcare professionals who listen to this program. Are they having this conversation? Are they aware? Are they taking this problem serious enough?
I personally don't think so. No,
I don't either. I agree with you.
Yeah, really primary care providers are often the first line of mental health care for many older adults. And they need to play a greater role in doing these types of screenings and assessments for mental health conditions among older adults. And when they can't provide, the full range of services, they need to refer their patients to psychologists like Dr. Mendoza and others who can do things like, cognitive behavioral therapy, which we know is effective as an intervention for older adults who have depression.
Mm-hmm.
Hey, here's my admission. Here's my confession. I'd be terrified having this conversation with an older relative or friend. If they said yes, I wouldn't know what to do. What do you say at that point? And we talked about earlier, reach out and get help. But I mean, in that moment, how do you have that conversation with someone?
I think that you need to reassure them that you love them and you don't want them to hurt themselves. It's a time to be compassionate and understanding. And let them know you'll do whatever needs to be done to help them. Because what it is that people will commit or die by suicide because they're in pain. They're in a lot of emotional pain, and that's the only way they know to stop it. So I think by being supportive and loving goes a long way.
Yeah, I think also helping them connect to resources in the community is really important. At the National Council on Aging, we are the support network for senior centers, which are a great place for older adults to be engaged with their peers, with other older adults. But it's also a great way to connect with, services that could help them, perhaps in their journey as they get older. Including some senior centers do provide some types of simple mental health interventions. There are a couple of programs that we promote throughout the country that do screenings and assessments of older adults and talk with them, sort of like cognitive behavioral therapy, but help them think about what their goals are in life, through the end of their life, and help them realize those goals and what might the barriers be to helping them achieve those goals. And it could be simple things like, spending more time with my grandchildren, being able to be, physically active enough to maybe go to the playground with my grandchildren or spend more time with my adult children or things like that. So there's a lot of resources out there in the community that we want to make sure older adults are aware of. And I think connecting with the local area agency on aging in your community is a great place to start, because that's where you can find out about what types of services and interventions are available to help people with mental health conditions.
Well, ladies, thank you very much for joining us on this. There's no easy answer here. There's no quick fix, but at least I hope we've raised a little awareness and made people a little less fearful about asking the question and reaching out and addressing some of the loneliness and despair that we see as all of us baby boomers keep marching down that path. I thank you for joining us.
It was a pleasure. Thank you.
Thank you so much.
Thanks, both.